Hello, everyone, and welcome back to Reinventing Mental Health, where we are moving beyond symptom management to root causes and natural solutions. Today, I have with us our friend Vanessa Morgan with the Self Heal Center. So, thank you for joining us today, Vanessa. How are you?
Really good. Yeah, thank you. I'm excited to continue the conversation, that some of the conversations that we've had so far, and really grateful for the opportunity to share this with your audience to, help as many people as possible. So thank you for
Of
inviting.
course. I'm so glad that we ran into each other and we've had the ability to connect and have some conversations. So, tell our viewers a little bit about you and what do you do at the Self Heal Center?
Okay, well, I am a practitioner of natural medicine. I always say I got abducted by the plant kingdom when I was about 17 years old.
Mhm.
And so, really, my whole life has been dedicated to like the study and the practice of different aspects of natural healing, natural medicine. I have a degree in medical herbalism. I am a licensed acupuncturist. I'm also a qualified homeopath. And I spent a lot of years studying in Germany and living in the UK. I was over there for 14 years. And I kind of incorporate the principles of what we call European biological medicine
Mhm.
with the concepts of Chinese medicine. So,
Okay.
sort of pulling from, modalities and principles and understandings from kind of East West. I've worked in clinics and hospitals my whole life, and I'm now at my 54th year
Oh,
of,
congratulations.
yeah, it's kind of fun. And I was moving towards retirement. I closed my last kind of brick and mortar practice in Durango, Colorado, just the year before COVID,
Mhm.
actually, when all that happened. Of course, a lot of people were reaching out to me, what do we do? What's going on? And yeah, the further conversation we're going to have evolved from that. So
Mhm.
I haven't retired yet. There's more work to do, I guess.
Well, and sometimes the universe tells us you're not done yet.
Yeah, exactly. We're not done with you yet.
Okay, so
Yeah.
tell us a little bit about the type of diagnoses you like to work with and maybe some trends that you're seeing right now or have been seeing since COVID.
Yes. Again, from my training in Germany,
Mhm.
I've been utilizing something called EAV testing since the 1980s, and that it was developed by a medical doctor, Dr. Voll, Reinhard Voll, in the 1950s.
Okay.
And the technology has evolved quite a bit, but it's a way that I can take an electrical measurement from
Mhm.
the energy, the flow of electrons through all the organs and systems through testing the meridians.
Nice.
And I was exposed to that. I just thought, oh my goodness, this is a way similar to kinesiology, but a little different where I can get information from the body
Mhm.
and I can ask the body a lot of different questions. And then I do also evaluate blood labs, look at blood work. I'm not a full blown functional medicine practitioner, but was taught by a naturopath in the 70s. He introduced me to this different way of looking and evaluating blood labs. So
Mhm.
I also incorporate that. And then using traditional Chinese medicine when I'm in person, looking at the tongue and listening to the pulse, and
Mhm.
also like the voice and different other ways that we read the facial coloring and markings and things like that. And the other thing I've been really involved with, which also comes out of Germany, is the dark field microscopy,
Oh,
where
what?
we look at live blood.
Mhm.
And also trained in Germany with the Gunther Enderlein was the zoologist, right, that brought forth a lot with that pleomorphic evolution, evolution of the pleomorphic understanding. So he had a protege named Willie Priga, and I had the good fortune of studying with his daughter in Hanover, Germany. And so I incorporated that also into getting a complete picture. I mean, as you know, different forms of tests are going to give us different kinds of information. And I love kind of connecting the dots and bringing that information together. So, yeah, that's a little bit about how, and, just through the classical homeopathic tradition, I, also just question the person. I have a reasonably epic intake form, that also informs me quite a lot about what may be unresolved, in that I call it like in a person's backpack that they're still carrying from their childhood, even birth experience and in utero. So, yeah, I kind of put all that information together. So,
People can be such a puzzle to put together and like figure out
yeah.
like what's the yeah.
It is like putting together pieces of a puzzle when I do a consultation for someone.
Yeah. Now, as I recall, you also do some venom medicines.
That also evolved out of the COVID experience. And it's kind of an interesting story, not too long, but filled with lots of synchronicities. So I just kept kind of following the yellow brick road on that. And the first thing was I was listening to a podcast, and the person presenting was talking about some Italian researchers that looked at the blood, actually blood, urine, and feces of people in Italy that tested positive for COVID. So at that point, it had nothing to do with the mRNA. Can't really call it a vaccine, but that development. And so he was saying that in the blood, they identified 30 some snake venom peptides in their blood. So my brain did the same thing. I was like, snake venom, that's weird. And so a light bulb went on, and I thought snake venom has been used homeopathically as a remedy since 1832. The first proving of lachesis or lachesis. And so I went to my library and I pulled out all these, materia medicas, right, which are kind of like the Bible of homeopathy.
Yep.
And literally 4 hours later, I was down this massive rabbit hole. And yeah, my mind was actually blown, some of your audience, the principle of homeopathy is like cures like, or the law of similars, right? So you look at a patient and you see the picture that they're presenting, and then you match it with the remedy, right? That is the closest to that. So literally, and I do have these charts now, if you take a chart of everything that people have said they've experienced with either acute, long haul, and now vaccine injury, and what snake venom, homeopathic snake venom remedies treat, it's like 1,000% match. So I thought, wow, that's amazing. And then, as I saw in the clinic, I don't really feel like the quote viral aspect of COVID was really the problem, but it's a poisoning or like a toxicity from the spike protein aspect, right?
Yep.
And we know a lot more now as things have been researched and unpacked. So I just was taking that in. And then 2 days later, I got a voice message from a dear friend of mine who lives in Italy, but she's been patient of mine since the 1990s. And basically the voice message that she left went like this, sort of like this. It was like, I think I'm dying. I've had COVID 3 times. I've had to have I call it the jab 3 times. And she said, I leave my apartment, I go down, in the lift, in the elevator. And when I get to the street, I'm so exhausted. I have to turn around, come back, and lay down for a couple hours. And she said, my will to live is diminishing. Anyway, gave me some of her other symptoms. So I got back in touch with her, right away because, yeah, she's a patient, but also just a dear heart.
Mhm.
And she's in her 80s now. And, it wasn't like here in the United States where if you could avoid it if you wanted to. And I know some people, because of their job or travel or family, there was a lot of pressure to receive it, but you could find ways around it. But in Italy, or where she was living in Sorrento, you really couldn't like use public transportation. You couldn't buy groceries.
Oh my
you
God.
you couldn't function in society unless you had it, and everything in her was a no. But again, she felt that she had no choice,
Mhm.
and she had very severe reactions each time. So I just kind of like, I looked up for some reason. I was like, well, here we go. And after talking to her a little bit more, I said, okay, get your friend to go to the pharmacy. And I've been working with 5 snake venoms predominantly. And I said, get your friend to get you the homeopathic remedy for the king cobra, which is called nausea trip, because that matched her symptom picture closer. Like all the venoms share certain things in common, and then you can get more specific, right? So I made a couple other recommendations as well, just to help her body eliminate the spike protein. And 3 weeks later,
Mhm.
she went on a holiday with her friend to Sardinia.
Oh, yay. I love to hear those things.
I know. And I was just like, oh, yeah, because I was really concerned about her. So then I just started, I mean, not exactly experimenting, but yeah, prescribing different venoms for different people that
Mhm.
were unresolved cough. And it went well into the mental emotional sphere as well. All the fear, the anxiety, depression, feelings of isolation, and have had, continued, I guess you could say, success, or, very positive results. And since then as well, I've gone down massive different rabbit holes in relation to it, and why it is such a fit for what I call, the COVID experience. And then I've done some online trainings with practitioners.
Mhm.
And the last 2 years, I've been invited to present for the Society of Homotoxicology in London, the UK, which homotoxicology is the study of the effect of toxins on
Mhm.
humans. And so that it's been very well received because the majority of people there work with homeopathic medicine. And yeah, and I also was invited to teach kind of a graduate program at the Northwest College of Homeopathy outside of Manchester.
Okay.
And, been meeting, yeah, very interesting homeopaths that click with this right away. And, again, I've been wanting to, share it with other practitioners so that we can bring this into the treatment protocols that people are utilizing. Yeah.
So I don't know who's talking about this so much over in other countries, but I know in the United States, Artist is the one who's been talking about this a lot.
Yeah, Brian Artis is one of the first people that really brought this forward. So, we have a lot to thank him for. And of course, his approach, he's done so much research that has been really a huge contribution to helping people. And of course, the nicotine and working with those receptor sites has been really important. And yeah, for me as a homeopath, I felt I've gone in this direction and actually haven't found a lot of people in the kind of in the mainstream working with it homeopathically, but I had, well, just interesting synchronicity where in Australia there is one homeopathic company that has been putting out some information, but I ended up meeting a homeopath in Scotland when I went over there 2 years ago. And we got together and just really clicked, got on like house on fire, as they say. And we've been collaborating the last few years, and that's been really wonderful. We did a series on her Patreon channel. We went into each one of the Venoms, so it was more geared towards homeopaths, but open to anyone interested in exploring it.
Hmm.
And in Australia, in the US, in the UK. So I was giving a talk at the local co-op here about 3 months ago about, basic homeopathy and first aid and different groups of remedies. And I touched on the venom. And there was a woman that attended who was from Australia, and her mother had reactions to the mRNA and went to a homeopath who had heard from Giovanna about snake venom. Anyway, it was just these
The circle. Yeah.
great little synchronicities occur. So it really has been an evolution as well. And I just continue to work with it with people. And just a few weeks ago, I got a referral from a local clinic here of a woman that was vaccine injured.
Mhm.
And being like, it's interesting, right? Because different people are going to present different symptoms
Yep.
depending on their own unique terrain
Yep.
and their constitution and things like that. So it's, as you know, in your work, yeah, it's not just a one size fits all, or it's going to affect everybody has a lung issue or everyone has this or that. And but in this person's case, and we've seen it waking up other pathogens in the
Yeah.
body that may have been dormant, like a lot of
Yeah.
people.
We've seen Lyme and
The
Bartonella and Epstein-Barr.
Yeah,
Yeah.
exactly. The kind of more chronic fatigue thing.
Yeah.
So this individual had had a really severe, I guess, the viral syndrome of some kind some years ago, and had more or less resolved it, but that came back up and just extreme inflammation in her body. And she really had only been on the protocol for less than 2 weeks
Mhm.
and already was seeing, really positive results with it. And, then for other people, the fear of death or the fear of the future now has been, anxiety and
Oh, yeah.
worry has really accelerated. And I was on a train in England, and all of a sudden, just looking out the window, but all of a sudden this whole thing dropped in of all these different correlations between what you experience if you get bitten by a snake and what we collectively experienced through the thing.
Talk a little bit more about that.
Yeah,
What exactly are you pointing to?
it was really fascinating. So, for example, And I can use her name, Bernie, who's my Italian friend. She did a video testimonial for us, and she's happy to share that. But one of the first things that she experienced with her first jab was severe pain at the injection site that radiated up and down her arm for like a couple of months.
Wow.
And after she took, and she worked with an acupuncturist,
Mhm.
and it took him like 3 months to kind of unravel that first round that she had.
Mm.
But anyway, one of the first things that happened when she took the remedy was that injection site got all aggravated and just for about 24 hours, and then it cleared. So what happens when you get bitten by a snake? To me, there was, this kind of correlation between the actual being injected with poison and being bitten by a poisonous snake. So that was kind of the first thing. And then I thought, okay, what's one of the first things that's going to come into your mind when you get bitten by, like I live in the Southwest, like a rattlesnake, for example,
Mhm. Yeah.
was one of the first things that's going to come up in your mind is I'm going to die is near potentially. And what did we all experience collectively, right? When COVID hit, a lot of what was circulating was we're all going to die or we might die from this, right? So that was one of the first things that I saw. And then the second thing was that social distancing, right? Then we were told that we have to stay away from other people. And what do snakes, when we see or approach a snake, one of the
Mhm.
first things we do is try and get away from it, right?
Oh, wow. Yeah.
And so I thought, well, that's interesting. And a snake, so there's another thing in herbal medicine and homeopathy we call the doctrine of signatures, which is the thing, right? Of if a plant looks a particular way, like if it's heart shaped, it can be helpful for the heart, for example, or like hawthorn berries are red, which relates to the blood and the heart. So in with Giovanna, she and I got really into the signatures of the snakes.
Mhm.
But again, what a snake will do is it will warn you, it will, like, for example, a rattlesnake will
Yeah.
say, don't come any closer, right?
Yeah.
And it will set this boundary. And then another correlation that I saw that I thought was interesting too was with venom, one of the things, first of all, a snake, most snakes, when they first bite you, they secrete or they inject into you something that paralyzes you.
Mhm.
Then they can eat you, right?
Mhm.
So with COVID, again, we were paralyzed. We had to stay at home, right? We were we beyond social distancing. If we were out in
Mhm.
public, we were even told that we couldn't leave our homes. Again, that's something that when you get bitten by a snake, like you can't move, you can't go anywhere, you're paralyzed. So yeah, anyway, I just kind of like went through this whole process
Mhm.
and just started to see those kinds of things. The other thing too is another thing that in with that venom, a lot of people have symptoms where your throat starts to shut down and
Yeah.
close down. And I correlated that with the censorship. We weren't allowed to speak out.
Mm. Okay. I see all these correlations.
Yeah. So that was kind of a whole little section of it that I ended up exploring. And then another thing, yeah, that I'd like to share too is that when this all came about, it was definitely about COVID, right? And another big aspect of, again, being bitten by a snake is you're a victim.
Yeah.
You're, you've been victimized by this, right? And so I think that was a huge aspect of, again, the narrative. We are victims of this, and power, giving your power away
Mhm.
or taking your power back, which has been a big part of the unfolding of this experience.
Yep. A
And
lot of people. Yeah.
yeah, and a lot of the correlations as well in the spiritual realm to me started to happen, that and the symbol of the snake is in all kinds of medical, I mean,
Mhm.
uses, right, is the
Yep.
snake that represents the DNA, and how this vaccine interfered and in a lot of cases has
Mhm.
manipulated or changed the DNA,
Yeah.
right?
But the
And,
serpents throughout the Bible too.
and
Mhm.
this has all these relationships with, yeah, the kundalini and our power,
Yeah.
and gaining, standing in our power,
Mhm.
expressing our power. And a lot of this COVID thing to me was about trying to take our sovereignty and our power away.
Yep.
And
Mhm.
another big rabbit hole I went down was, yeah, looking at pretty much every indigenous culture in the world
Mhm.
and every religion. It wasn't until the Garden of Eden story that the snake became the devil.
Right.
And I mean, I'll leave it there because that, there's a lot of avenues you could take on that. But to me, it really reflected, again, like in the Southwest, for example, the Hopi,
Mhm.
they have a snake clan, and every year they do a very powerful ceremony called the snake dance.
Mhm.
And they go out, it's a certain time of year, and only initiated people can be involved with the snake ceremony. But there are videos of this, and I have pictures in my one of the presentations that I give where they gather the snakes, they make a procession into the kiva area. They're holding snakes, they have snakes like in their belts, and no one gets bitten, no one is injured.
Mhm.
And it's a way of shamanically what we would call like feeding the holy, right? Like
Mhm.
honor the medicine and the power of the symbol, what the snake represents, which is fertility. And since COVID, fertility rates are down.
Oh,
We had
huge.
a lot of
Mhm.
hormonal problems.
Yep.
I mean, I don't want to sidetrack too much, but that is a whole other area, right?
Mhm.
Yeah, there are temples in India where they do similar ceremonies, and there's like a sect called the Nag, which, are,
Mhm.
they honor the power of the snake in the Hindu religion.
Yep.
So the more I looked into this, the Aboriginal people of Australia also have a strong connection with the, again, the spiritual medicine of the snake.
Mhm.
So again, when I got drawn into this,
Mhm.
Mary, okay, this is helping people with COVID, but it's gone way beyond that
Yep.
in its impact on people. Because when you take a remedy from the venom of the snake, it's connecting you to this bigger medicine.
Mhm.
And I've had, for example, yeah, kind of a whole little group of young women in their 30s that I was working with that said, I grew up with a narcissistic mother, and now I am like setting those boundaries and I am
Mhm.
taking my power back. So, again, it started out as COVID, but I feel like it's gone even deeper
Mhm.
and helped people release that intrinsic fear of death, that we all have. And a lot of things, a lot of the ways that, say, however we gave our power away or, it was taken away, I'm just seeing people like take that back.
Mhm.
And it's been really amazing. really amazing.
So
So
cool.
yes, it's gone in, into a much broader area than I thought. Or several people will contact me after they've just started the remedy. This usually happens in the beginning,
Mm,
and they're maybe having dreams about snakes,
mm,
or they are having very deep healing dreams about traumatic experiences that they've had, maybe in childhood, again, where there was a loss of power or of their aspects of themselves. And I feel like this medicine is helping people to take that back, as well as, the concept of like cures like,
yep.
explain to people that are really new to it.
Mm,
On the most basic level, venom is one of the most poisonous things on the planet. And then you've got, we were poisoned. And several patients would say that to me in their intake. They'll be like, I feel like I've been poisoned.
mm-hmm.
So you have this neutralizing of just the toxicity. And again, I'm sure a lot of your audience, we know all the ways we've been poisoned over and over.
Hmm.
How Dr. Artis Brian has pointed out all the other ways that venom has been incorporated into our food supply,
Our makeup, our body care products.
pharmaceuticals, like
Mm,
anything that has a prill at the end of it has venom in it. So blood pressure medications, things for post-stroke, and again, paralysis, and
mm,
that's the, yeah, so to me, there's basically 5 areas that COVID impacted us,
mm,
and there's 5 areas that venom treats.
mm.
And the neurological, the nervous system,
Yep.
and the immune system. Unfortunately, what we're seeing with the turbo cancer
Yeah.
explosion, and then other infections coming back online,
Mm,
and also the mental and emotional sphere definitely has, and the hormonal aspect. Oh my goodness. Yeah. And this goes into, yeah, the area that, and the circulatory system, clotting. I have this short little video on my website. Got into all kinds of things with this, but
mm,
this scientist is in a lab in Australia,
mm.
and he has, a reporter there, and they draw some of her blood and put it in a vial, and she gets literally 2 drops of snake venom from this poisonous snake. They milk the snake and put it in, and within not even minutes, within seconds, the blood is jello. She takes the cup and turns it around, and it's just like this blob of jello. And again, all the clotting,
Yep.
that's how snake kills you, right? That venom coagulates the blood, and then there's no oxygen and you die. I mean, that's one of the mechanisms. And so all the circulatory aspects that we've encountered with it.
Mm.
So yeah, it has a broad reaching impact depending on how and where in an individual the spike protein has affected us.
So, one of the things that I have found so interesting post COVID is the number of people who didn't get the vaccine and still seem to have long COVID symptoms.
Yeah, shedding is real.
Yep.
And depending on what we think or feel about that, I think, well, actually, on Substack, is a Midwestern doctor. I don't know
Mm-hmm.
if you know him, but I really respect his work.
Mm-hmm.
And he did a lot around the shedding situation. And I actually, I mean, I won't go too far. I had my own personal shedding experience flying back from Austin to Albuquerque.
Mm-hmm.
And this was a little over a year ago. It was November of last year. And within 3 days, I had very extreme symptoms.
Mhm.
And, and again, synchronistically, I was due to have like my annual blood test. Had gone before my trip to Austin, and the phlebotomist was sick that day. And so, had I had my blood drawn before I left, I wouldn't have seen what happened. But anyway, I was flying back, and the woman sitting next to me was a medical doctor who runs a pediatric clinic in South Texas. And I don't know why, because I don't necessarily say, "Hi, I'm Vanessa and I work with snake venom,"
Mhm.
uh, for COVID. But anyway, she sat down, and I really liked her, really lovely woman. And, we just started chatting, and I felt like I was like a priest in a confessional. She just started like sharing all these things with me. And basically, she's in her 50s. She's
Mhm.
now on 4 medications, beta blockers,
Mhm.
statins, blood pressure, you
Mhm.
know, and has had to reduce her hours, and started saying that she felt it was from if you worked in a clinic. I mean,
Yeah.
they got multiple jabs. And she even started saying that, like, in the break room, standard of care, the emotional and psychological impact on a lot of these medical professionals is
Oh,
real,
for sure.
because they're very caring people for the most part. And that was kind of forced upon them as well, that they had to be administering this.
Yep.
She said in the break room, they were all like, "Oh my God, we're seeing all these problems, all
Mhm.
these side effects." And they started refusing further boosters.
Yep.
Anyway, she was very unwell from it. And I thought, oh my God, not even you can't make this up. But I just kind of, and I look up, I'm just like getting on the plane wanting to read my book. And all of a sudden, here it is. And I
Mhm.
said, "Are you familiar with homeopathy at all?" Because I don't try to talk people into anything. And, that's just not me. But I said, "Well, I," she did ask me, "Oh, and so what do you do?" after she talked to me. And I said, "Well, as it happens, actually, I'm a homeopath. And this might sound really weird, but I've been working with homeopathic snake venom, and it could be helpful for you, if you want more information." Duh. Of
Mhm.
course, I never heard from her, and I didn't expect to. But what ended up happening, what I realized too, was like we were really kind of leaning in a little bit, right? Because you're on a plane and it's a controversial topic or whatever. She was basically breathing on me.
Oh, and it was recycling through the air in the plane too, if it was in that time period, you know?
Yeah, and it is meant to be this self-replicating, like people become these spike protein
That's
manufacturing.
exactly what the mRNA is supposed to do. That's why they made it the
I
way they did.
know. Got home, and I remember because it was right around like election day, was a few days later. And within 3 days, I couldn't get up off the couch. And I felt like, I mean, I live at altitude, not 10,000 feet or anything, but, and at night, I was just like, I'd wake up a few times, I would like walk around. I hooked up my ozone machine. I started drinking ozone water, but
Yep.
I went down to the clinic and I got my blood drawn, and I was diagnosed with erythrocytosis. And I looked it up, and I had every single symptom. And basically, my body was producing too many red blood cells to try to get more oxygen. And I could only imagine. I didn't have my microscope set up, but I do now. And just all the fibrogen in my blood or
Yeah.
whatever. And thankfully, I knew what to do, and immediately, put myself on a whole protocol.
Mhm.
But it, and then But what was also cool was I had those blood labs, and then I treated myself and then had them repeated 6 weeks later,
Mhm.
and everything had gone back to normal. But I woke up once in the middle of the night because at first I was like, "What the heck? It doesn't feel like a flu," or,
Mhm.
and then I saw her face, and then I thought, "Oh my goodness, I bet you I was shedded. I received a big dose." And I just was talking with, yeah, someone yesterday about this, because now when I do an evaluation for people, I do like it's, a snake venom medicine consultation sort of thing. I just focus in on that.
Mhm.
And I test everybody now, with this equipment, and I just ask their body, zero, and what is your spike protein level? And I know a lot of people now, there are some accurate tests, right, that have come
Mhm.
out now where they can measure the amount of spike protein in your body. I tested this young lady and I said, "You're at about a 4." To me, people start feeling really unwell from it, when it starts climbing above 5.
Mhm.
And she goes, "Well, I didn't have any, like you said, I didn't have any of the jabs, and she eats really well and this and that." I said, "Listen, you just have to go into the grocery store, or you went to, this event the other night, and yes, a lot of the people that you interact with also may have opted out, but our local co-op, very small, the aisles are small."
Mhm.
I met this one patient that I mentioned to you, and to give her some remedies, and then she's in the co-op shopping, and passing, like, it's just in our environment, unfortunately. Now I think it is the reality of the post-COVID thing. Yeah.
Well, and so even going further with that, talking about some of the things that artist has discussed regarding it being shed in urine, and the fact that our water system is constantly recycling that stuff. We're getting people's hormones, we're getting people's all their dirty cells.
Antibiotics.
You can have the cleanest possible life, and you're still unfortunately going to be exposed because other people don't have the cleanest.
Yeah. Unfortunately, it is the way of the world right now. And thankfully, there's a lot of things that we can do. And we, if we didn't, or if we weren't proactive about our health and well-being prior to COVID, to me, if it's one thing that COVID has brought forward is, there's nobody in here but you, and you've got to look after yourself.
Yep.
And yeah, for example, here, thankfully, the water is so crucial, right? It's so
Mhm.
foundational. And I'm on a well, but the water is very hard. So at least I know there's no fluoride and, other municipal water things being put in it, but it's still very hard water.
Mhm.
And yeah, anyway, I filter it and I restructure it and I do certain things because that is another way that, toxins
Mhm.
get out of the body. And again, last year when I presented at the conference in London, I focused specifically on the circulatory system,
Mhm.
and all the ways that you can support that to maintain health, because obviously that's one of the main areas where the
Mhm.
spike protein is having an impact. And as we know, the myocarditis and the heart disease and stroke and all these things, it can be discouraging, right? To be
Mhm.
like, how can I stay healthy? But we can, and we have to carry on, I feel like, with the work that we're all doing.
Yeah, I agree.
I have so much respect, for everyone that, when we met at the Children's Health Defense Conference, has really also dedicated their lives, to to helping others. And, a lot of people's lives, we know Andy Wakefield, and
Yep.
many of these people, Sayerji and multiple people, were basically blacklisted and really had serious impact, on their lives as a result of standing up for the truth. But thankfully, I do see things changing and improving. But, to the hormone thing, because, I know you're putting a lot, you're connecting lots of dots in that area,
Yeah.
mental health and the hormonal issue. Again, unfortunately, what I saw with COVID was young women in their 20s, their periods stopped
Yep.
after their first or second jab. Women that were perimenopausal, or, in that
Mhm.
teen time, were hemorrhaging
Oh my goodness.
and
Yeah.
very heavily. I had one patient, anyway, yeah, she bled for 90 days and then reached
Oh my
out.
God.
So severe blood deficiency, which causes a lot of mental emotional
Oh,
symptoms.
for sure. Yeah.
In
Yeah.
Chinese medicine, I did see, I mean, it wasn't hundreds, but some women that were menopausal that started bleeding.
Yeah. We've seen things all over the place, and it's been boys and girls. So
Yeah.
we've had girls in our office as young as 5 having periods already, which is completely like their brain's not ready for it, their body's not ready for it.
Mhm.
Emotionally, they cannot handle this.
Yeah.
We're having to do intense work around the counseling aspect of the trauma of this happening so young. But we had a 17-year-old male who came into our office, and all of his symptoms, I was like, yeah, this isn't adding up for me as far as like, yeah, you've got mental health symptoms that are presenting right now, but there's a huge overlap with these physical health symptoms that you're telling me. Because as a
Absolutely.
17-year-old boy, if you are at the gym and you're working out more than 3 hours per week and you're not gaining muscle, there's a hormone issue here.
Totally.
So we actually ran a hormone panel. His testosterone was only 25 at 17. Can you imagine for a boy? So every
No,
symptom
it's
that he had was because his hormone balance was totally off.
absolutely, absolutely. Yeah, it really is astonishing. And, talking about sort of correlations, or the thing I love about Chinese medicine is that it really answers gives a lot of understanding around the interdependence and the interrelationship of everything, right? So here's something that I saw that also was like, whoa, early on with COVID. In Chinese medicine, the kidney essence, or
Mhm.
the jing, they call it the jing, it holds your DNA. And the kidney energy in Chinese medicine is the ability to reproduce, and it produces your hormones.
Mhm.
And well, as a sidebar, it also creates your immune system and your digestion, and then other elements carry on the maintenance of that. But it's like it's the element of water, and we say life comes from water, right? And that, yeah, it ignites the five element theory of creation, right?
Mhm.
And with the testing that I do, with this EAV, I take these measurements, and one is the kidney meridian. And in a bunch of people, I just saw like it tanked. And
Wow.
it wasn't that was a pattern that they already had. It was just from either, COVID. And that it was just taking it out at the knees. And I was like, oh my God, well, this explains why we're seeing all these miscarriages
Yep.
and hormonal issues and infertility now that the fertility rates have dropped.
Yep.
And yeah, so I brought in for those people, there are some wonderful Chinese herbal formulas, traditional formulas
Mhm.
that, that rebuild or bring that energy back in. And so for a lot of people, if that foundational energy was again taken out, and it's what passes on the DNA. We know again there was manipulation with this. So that was another just clinical correlation that I saw from testing lots of people.
Yeah.
But the
Love it.
answers are, we do have answers. And yeah, I think that hormonal piece is really huge.
Yeah. It's having a massive impact. And when your hormones are off, this is not just physical health, this is mental health. And, they overlap so much.
Like, again, I mean, you would know much more about this than I would. But again, in Chinese medicine, each organ system has an emotion that's correlated with it. And there's this body mind connection and you can't separate. So if something's off physiologically, it will create that emotion, right? Or, yeah, yes, if someone has an unresolved trauma and there's a lot of like worry or fear, and that will have an effect. It's a two-way street on that organ or system, and then you get into this chicken and egg situation. But in order to bring that back into balance, which is wonderful that, yeah, that you're sharing all this, because you got to work both sides of that.
Yeah, neither of these is an island. Like this, we are
Right.
a beautiful machine, and we have to look at ourselves like a machine. We cannot assume that this is all by itself.
This is not separate. No. And often, again, that's what I love about Chinese medicine. When you look at a case in that way, it'd be like, actually, for example, here's an example: high blood pressure, right? That's the fire element. That's the heart. Well, that can be caused by two things in Chinese medicine. It can be a deficiency of water, which is that kidney energy, because they say water controls fire. So everything has to be in balance, right? So if there's not enough water, then the fire will blaze and the blood pressure will go up. So that's actually a deficiency causing that. And so again, as we know in allopathic thinking, they just like force the blood pressure to go down.
Mhm.
Or it's an excess of wood, which is the liver energy.
Mhm.
And that is the mother of fire, right? Wood creates fire. So if you have too much heat and fire, which is toxins, then that can cause the blood pressure to go up. Yeah, support all these different mechanisms and not just like forcing the body to do something.
Absolutely.
There's so much that we can do. And I think, back to like the very beginning of our talk, I guess that is, why I haven't retired yet is, like there is a lot we can do. People just really need to educate themselves and really take responsibility for their health and really be as proactive as they possibly can. Because there are so many of us that are finding different ways within the natural medicine to help and not just suppress the symptoms. Yeah.
Well, great conversation. I enjoy talking to you. I feel like we could probably talk for a few days. So,
Yeah.
how do people reach you?
I have a website, is selfhealcenter.com, all one word. I do have a Substack that we've just started in the last couple months, and we're starting to post things up there and share information as well. I do offer courses like online and in person, and in this year I'm overhauling, we're getting new data all the time for the Venom work. And so I'm excited to be sharing and doing some workshops this year to, keep that momentum going.
Good.
And so my website and the Substack are the best ways to find me.
Okay. And I'll make sure that I get those from you in an email so that we can post them.
Well, thank you so much, Mary. Yeah,
Thanks for joining us.
it is a whole thing, and I love how it kind of dovetails together. So I really wish you all the best with everything that you're launching, and
have to find some ways for us to do some collaborations and bring you in on some of our summits that we have coming up. So
I would love that. And, Austin isn't that far away. So, um,
yep. No, I absolutely love it. All right. Thank you again for joining us today, Vanessa. We will definitely be inviting you back on to have another conversation because we can talk about quite a bit, it sounds like. For all of our viewers, please remember to like, share, subscribe, and follow. And please comment. That helps move us up in the rankings.